Hey everybody, Mike from the COPD Foundation here. We're talking about a lot of coping mechanisms this month with COPD. And right now we're going to talk about coping with some of the financial aspects of COPD, most notably dealing with Medicare. As some of you may be aware, Medicare open enrollment is coming up from October 15th through December 7th. So this is a great time to kind of give your Medicare coverage a little bit of an overview. Maybe some things have changed in the last year or so. Maybe you're new to Medicare. We've got a lot of different situations going on out there, and I'm here to help you try to make some sense out of this. Now, a couple of caveats as we get going here. It's important to remember that everybody's case is going to be a little bit different, and every consideration and every plan and all those sorts of things are going to be very individualized. So we're going to keep it pretty general today. We're going to go over some of the basics of what to look for and how, some of the things to contemplate as you start going through the process here. But it's also very important to make sure that you're making the best decisions for you. And as we get toward the end of the presentation here, we're going to talk a little bit about some resources, some people who can help give some more clarity and shine some more light on some of your options. Again, it's also important to remember when you're dealing with these sorts of things to get your materials from a reliable source. Perhaps the most reliable source is this booklet here that the Centers for Medicare and Medicaid Services put out every year. It's called Medicare and You. It's the official U.S. government Medicare handbook. Pretty freely available. I believe a lot of people who have already been on Medicare will get one of these in the mail. I got this one from our local health department. A lot of senior services programs and other similar types of organizations will probably have these available as well. But we can certainly, you can certainly get these also by calling 1-800-Medicare. And again, we'll have a refresher toward the end here. This book is really kind of the be-all, end-all for a lot of things. It's very convenient. It has a lot of plan information sorts of things to help you make these decisions. And most importantly, they are specialized for your individual state. This one is for Michigan because I'm in Michigan. Go Mitten State. So, again, we're going to be using material from this. We're going to be using material from Medicare.gov. We're going to be sticking with some very reliable sources as we get through some of the talk here. First and foremost, in order to understand what all the options are, we have to kind of take some stock about what the individual parts of Medicare are. Because as a respiratory therapist, I have dealt with a lot of people who maybe haven't had to contemplate or think about the different types of Medicare, the different plans, the different coverages. Again, maybe your situation has changed over the last year, and now you're looking at some other things that maybe you hadn't had to think about before. So let's take a look at some of the individual components of the Medicare program. First and foremost, we've got Medicare Part A. Medicare is the overall program is divided into these parts. And so we're starting off with Part A, which covers your basic inpatient hospital care. If you get admitted to the hospital, Medicare Part A is what's going to cover this for you. There is a monthly premium for it. There is a deductible, and there is a 20% copay to a lot of these services. So basically, if you only have Medicare Part A without any kind of supplement, you're going to be on the hook for about 20% of the hospital cost. Part A also covers inpatient skilled nursing facility care with the same caveats of the deductibles and all the out-of-pocket expenses that you're going to have to cover yourself. It also covers hospice care at that stage. And then it does cover some home health care. There are some overlap here between Part A and Part B, which we're going to talk about in a moment here. But there are some very limited outpatient things that can be covered through this. Speaking of Part B is, as you might expect, this is a lot of your non-hospital stuff, what we might call ambulatory care or outpatient services. These are when you go see your clinician, your doctor, your nurse practitioner, your physician assistant. These are your clinic services, your office services. Those types of expenses are paid through Medicare Part B. A lot of other outpatient services, labs, that sort of thing. All that is going to be covered through Medicare Part B because that's, of course, taking place outside the hospital. Importantly, for a lot of folks with COPD, this is the section that also covers your durable medical equipment. These are your nebulizer supplies, your nebulizers themselves. Interestingly enough, a special carve out for nebulizer medications are really about the only medications. The only medications that Part B will cover are things that are done in a doctor's office or a clinical office, or nebulizers, because the thinking goes nebulizer isn't any good without the nebulizer solution, so we're going to cover that too. Also, oxygen equipment, CPAP machines, your non-invasive ventilators, all that sort of thing, that's all considered durable medical equipment, and that's covered through Part B. Again, preventative services testing, because all that takes place in the outpatient setting, so that's where that's going to be. One of the newer add-ons to the Medicare program is called Medicare Part D. Medicare Part D is your prescription drug benefit. Outside of nebulized medications, or those things that are covered under Part B, these are the things that Medicare Part D covers. This is a relatively new component to the Medicare program. Been around since I think about 2006, and this covers your previous to that. Of course, no medications were covered by the Medicare program itself, but now this was the idea that or this was the plan that made that happen. Also, there are certain medication therapy management programs that are available through Medicare Part D, and those things can be very helpful. Those are things that make sure that you are using your medications correctly, making sure that you're using them at the appropriate time, making sure that they're not conflicting with other medications and that sort of thing, and just again managing the medication therapy, kind of what it says on the tin. Now, I'm sure many of you out there are saying, hey, goofball, you forgot a letter. We went all right from A to B, and then we skipped over to Part D. And that's because Part C is kind of an odd animal. Medicare Part C is more commonly called Medicare Advantage. And this is, again, a relatively new component to the Medicare plan, the Medicare program, wherein essentially a commercial insurance provider can bundle the inpatient coverage, the outpatient coverage, and the medications all in one thing. It's a little bit separate from what they call original Medicare now, because that was more handled strictly by the government, and this is kind of the government provides a contract to a lot of these other payers and says, okay, you run with the ball now. You can bundle all these things together. You can even add in things like dental and vision, whatever you want to cover, and perhaps that might be a more economical option for a lot of folks. And indeed it is. Again, of course, when you get into the intricacies of medication plans and all that sort of thing, sometimes it is appropriate to go with one of these programs. And sometimes people even go back and forth depending on their needs. There have been people who can, during this open enrollment period, do go back and forth between original Medicare and Medicare Advantage, just again, whatever fits the particular needs for that individual plan year. And again, this is kind of similar to anybody who has had more traditional commercial insurance, and often the same companies. You see a lot of the same players in this space, and it's very similar to that, just under the banner of Medicare itself. Important to note also that it is still subject to Medicare rules and regulations. These are, again, the government sets out a framework and says, you have to cover X amount of things. You are free to cover whatever you want and, do all that sort of thing if you feel that's going to make your plan more appealing. But there are certain base levels of coverage that are required to be offered. Now, outside of the Medicare parts specifically, there are also another couple of things that are important to take note of as you're considering what kind of Medicare plan is best for you. The first of these is what's called a Medicare Supplemental plan, or Medigap. These are plans that work with original Medicare only, because there really aren't as many gaps in Medicare Advantage. There's not really the need for this. But they're kind of, if you have an original Medicare plan and you don't find an Advantage plan that really works for you, or you're not comfortable with any of them, you can get one of these Medigap plans, again, from usually a commercial insurer, generally a commercial insurer, to fill in the gaps. Can help cover some of your copays. You may decide that a little bit extra premium is going to offset not having to pay for medication, or excuse me, not medications, but office visit copays or the like. Again, these are a lot of the computations that you have to do, the calculations that you have to do in order to really figure out which one of these plans is going to work best for you. Again, unlike Medicare Advantage, these don't offer dental, vision, things like that. These are a little bit stricter on those regards. And they absolutely positively do not cover prescriptions because, again, this is back to the original Medicare. If you go on the Medicare website, you'll see that if you happen to have one of these programs from before 2006, I believe it was, when Part D came online, you could be potentially grandfathered into a situation where those plans could offer prescription coverages. But ever since we've had Part D, the expectation is if you're going to have Part A and Part B, and you're going to have a supplemental, then you should also get Part D if you need medications. And again, if you're watching this as part of the COPD population, medication needs are probably pretty foremost, or at least pretty significant on your mind. So that may not apply to you, but this is where we get into some of the intricacies and where people you may know may be making different evaluations based on their needs. Finally, we have this concept called Part D Extra Help. Exactly, again, what it says on the tin, this is an assistance program that's based on your income, including things like supplemental security income or SSI, that can, again, give you some copay limitations and that sort of thing. Usually these are the folks that have Medicare and Medicaid coverage together. Medi, sometimes it's called, or M&M, or depending on how clever you're feeling that particular day. But this does give you some extra support and coverage to make those medication costs a little bit more manageable. And again, that's why it's under Part D, because that's the medication deal. You get notified of your eligibility for this often automatically by Medicare. They have a color-coded system of different situations that can provide these coverages for you. Again, those are explained on the website or in the book here. I found them on the website, but you get a couple of different kinds of letters if you are Medicare, Medicaid eligible, if you've been evaluated for the program before, if things are changing. There are about 4 different colors that can clue you in that you're going to be eligible for this Part D. And of course, you can apply for it too if you feel you have a circumstance that maybe isn't addressed by the automatic enrollment, but still could use a little bit extra help, because who couldn't use a little bit extra help? Again, the copays are capped at less than $10 a piece. Generics are obviously a little bit less expensive than that, but the maximum you're going to pay it's actually $9 and change. So now again, if you have a lot of prescriptions, that still adds up. But considering some of the other copays that are out there, this really does provide some good service that may be of benefit to. So we've thrown a lot of information out there because this is, again, kind of setting the context for how do you make a decision about which option is best for you. We've got Part A, Part B, Part C, Part D, all this extra help, all these sorts of things. We've got a lot of information flying around. How do you decide which of these options really works well for you? Well, again, that's where sometimes things like this, I can show you here. Medicare Advantage and other health plans, specifically in Michigan, this gives us some really nice information about broken out by the particular plan, and gives us out-of-pocket limits, what your copays are for primary care, for specialties, for other Part B eligible drugs, chemotherapy drugs, DME, all that sort of thing. And this really, you can kind of map out how many medications do you have, how often do you go to your doctor, how many specialists do you have, and that way you can really kind of figure out exactly where your money would be best spent. Really helpful also for many of the plans, they also have a members rating. 84% of people are pretty satisfied with this particular plan. Some of them aren't available, some of them are a little bit smaller plans. But you can see like this one is 87%. So you can kind of get an idea of how people are satisfied with their plans, again, before you put your money into it. Now, again, still pretty complicated, still a lot of things to consider. So, on the Medicare website, they actually have not really a formula, but at least 7 things to think about when you are making these kinds of coverage decisions. So, we're going to go over those a little bit real quick here so that you can get a little bit more context and see exactly what you might want to be thinking about. So, first and foremost, costs. What are the deductibles like? What are the copays like? What are the premiums like? The amount you pay every month to get the coverage. Is it worth it to pay a little bit higher premium for a little bit more Cadillac type coverage because it's going to save you in the long run with the deductibles and the copays? Is it the opposite of that? Do you want to go with a smaller premium because you don't necessarily use your clinical services very often? You don't go to the office, you don't go to the clinic, you don't do those things so much, so you're willing to pay a little bit less every month and take the chance that you'll save that on the back end. Number one thing to consider, obviously, is cost. What's affordable and practical for you? Number 2 on the list is coverage. Of course, I've met several people who have been kind of trucking along on original Medicare for a while because it's fit their needs. Maybe they've had to take a generic heart pill, blood pressure pill, or a generic diabetes pill or something like that. Copays aren't really that big of an issue. Then all of a sudden you enter COPD land, where a lot of our out-of-pocket costs for our medications are really unfortunately high and really unaffordable for a lot of folks. So this is going to be that time where you're going to probably want to consider getting a Part D plan, or maybe switching to Medicare Advantage, because you need some of that additional coverage now. It's not practical to be paying $300 a month for an inhaler, or more practically $500-$600 for a couple of inhalers, or the nebulizer medications, or through Part B, or so on and so forth. And so you need to have a little bit more of a practical copay. So again, looking at the coverages, particularly in my opinion with medications, is absolutely critical because it ties into costs. I mean, all of these things often intertwine with each other. Do you have other coverage? Are you eligible for Medicaid? Do you have some private insurance, maybe through a retirement program or something similar to that, that's going to offset a lot of these coverages? Do you have something that is eligible through your workplace and you don't want to change, or it's really not doing good enough for you and you want to explore some options? What are your other coverages out there? Because again, this once again ties into cost and ties into the coverage that you'll get through a Medicare plan. So very important to consider as you're going through the process here. Again, how many prescriptions do you have? Are you on a Medicare Advantage plan that maybe has had a change, and a medication you were doing really well with is no longer on their formulary? They're not going to cover it anymore. Is it time to switch to another thing? Maybe you were on a medication, it came off formulary, they put you on something else, and you didn't really feel that one was working very well. You can go through on a lot of these websites, particularly through Medicare and through the programs, and actually look at their formularies, and you can go find your preferred medication. And assuming that the premium isn't too onerous, too burdensome, anything like that, maybe you would be interested in switching so you can get back to that medication that really fit your needs. Are there other medication therapy management services that you might want to take advantage of? There are a lot of plans that will offer care management and things like that. You may get a call from a nurse or a respiratory therapist or a social worker or somebody like that, just to periodically check in and say, hey, how are you doing with your meds? Do you have any concerns? Do you have any issues? Anything like that? Maybe that's beneficial to you. Again, all things to consider when it comes to prescriptions. On the back end here, we have facility and clinician choice. Again, when we're talking about a lot of these Medicare Advantage programs, because they're similar to traditional, so to speak, commercial insurance, a lot of these groups have networks or, preferred providers. You've probably heard that phrase before. And maybe something has changed and your clinician is not going to be in that preferred network anymore. Would you rather change clinicians, or would you rather change insurance providers? You want to make that decision, or at least you want to factor that in as you're trying to decide. Quality of care, again, we saw some of those reports there, or maybe you've had a bad experience with a particular carrier and you just want out. Again, sometimes it's that easy. Sometimes you're willing to pay an extra X amount of dollars a month because you got absolutely positively horrible customer service and you're tired of it. And it's time to move on. That's certainly a fair option and certainly something to consider as we get into open enrollment. And finally, thinking about travel. This is particularly true outside the U.S. because a lot of these plans will not cover travel outside the U.S. or costs that are incurred. If you get sick overseas or something like that. Some of them may, but so if you're planning on taking a trip in the next year, that might be something to consider. So as we get into, again, the complexities and the individual decisions that you've got to make in order to get some of these things done, these are the 7 things that are really important to consider. And again, a lot of it really kind of factors back into cost. Cost and coverage are probably the 2 biggest things, and absolutely the 2 most important things to make sure that you are you have a plan, you have a therapy plan and a prescription plan and all those sorts of things that are working for your lifestyle and your needs. So again, this was admittedly a very quick overview. Sir, we could spend hours and hours and hours going through the ins and outs of how to make every calculation and do all these things, but I wanted to make a video that people were actually going to watch and not get too tired of before the end of it. So wanted to keep it fairly general, fairly short, but there are fortunately a boatload of other resources out there that can help you make a lot of these decisions, or at least help you get some more context. Again, as I mentioned, there are a lot of senior services type programs that are very willing to help. There is the Medicare.gov website itself, which allows you to preview a lot of these plans. Again, very similar to what comes out in the Medicare and You book. You can look at your options. You can review a lot of these plans, particularly Medicare Advantage, Part D, all those sorts of things. You can also get some information directly from Medicare by calling 1-800-Medicare. They can certainly point you in the right direction to a lot of answers. Also, there are groups called state health insurance assistance programs, and you can see these are listed right on the back of our book here. Ours in Michigan is called MMAP. Not sure exactly what that is, but it says call this number for free personalized health insurance counseling. And the website for the state health insurance assistance program is very accessible and can point you in the right direction for the SHIP for your particular state. Very easy to locate these things, and these are volunteers who are very knowledgeable about all those ins and outs, and who will be happy to spend some time and speak one-on-one with you and get you the information you need. There are also some independent groups out there who are not affiliated with Medicare or affiliated with any other group. One in particular that we at the Foundation have worked with in the past is called the Medicare Rights Center. And again, they have some great resources to help you make the right decision, and again, to advocate for yourself. They also do things like help on policy and things like that, but they are fantastic resources to help you, again, make the appropriate decision for you and your family's needs. So hopefully we gave you some great information about Medicare, and that will help you get ready for the Medicare open enrollment season and help you make the best decision for you and your care plan. So again, my name is Mike Hess from the COPD Foundation. Really appreciate you spending some time watching this video, and take care of yourselves, take care of each other, and keep breathing easy.